Here's an instruction video on what you need and how you go about injecting your weight loss medication. So make sure you're following the guidance of your specific provider, but the basics are this. This is not this is not weight loss medication. This is bacteriostatic water for demonstration, but you'll need your vial, and then I have 2 gauze pads here. One is to clean off, and these have alcohol on them. If your kit comes with little alcohol swabs from the pharmacy or from your provider, you can use those, but I just douse these with alcohol, and then they're good to clean. So I take one of those and give a nice clean rub to the top of that vial, and then you're going to want to let that air dry really well. You can discard that first gauze. Then you have an insulin syringe. Now, not every insulin syringe looks exactly the same, and I'll show you why. Sometimes it'll go up to, you can see this is a 100 unit syringe. Some only go up to 30 units. Some only go up to 50 units. There are different sizes. And the only reason that really matters is because these little tick marks are not always the same unit count per mark. So you can see here, let me take off this bottom part. You don't need that for anything. It's just a protector and to show that it's unused and sterile. You can see this is a 100 unit syringe. So from here, when I draw this back, this plunger back, you can see that each little tick mark on there, each little tick mark is 1 unit. And I can tell that because if I draw back the plunger to the 10 line that's labeled, there is a divider here that shows it's 5, and then there's 5 little tick marks in between to indicate that each one of those is an individual unit. Not every syringe is like that. Say I drew back the syringe to 10 and there were only 5 tick marks in between the beginning and the 10. Well, then that would mean that each tick mark is representing the quantity of 2 units. So why does that matter? That matters because we're not always dosing in 10 unit increments. Sometimes we're dosing in 2 unit, 3 unit, 4 unit, or 5 unit increments. And if you go, okay, well, my provider said to do 13 units. So I'm going to go on this syringe, that would make sense to go 1, 2, 3 lines. And that would be 13 units on this syringe. But if my syringe were counting by 2s and I went, okay, well, there's my 10, easy to identify, forgetting that there might only be 5 tick marks here. And I go, okay, I need to go up 3 more lines, 1, 2, 3, then you'd actually be getting more than that. So make sure you look significantly at your syringe and understand how many tick marks are in between where you start and where the tick mark is. So I know this is 5, this is 10. Each unit of measurement on my syringe is a unit of insulin. If I pulled from the 10 to the 20 and there were only 5 lines instead of 10 in between the 10 and the 20, that would mean that I needed to count by 2s for each line. Hopefully that makes sense. Sorry if that was too much. If your syringe matches mine, then that probably seemed really obvious. If you're watching this and your syringe doesn't match mine, then that was probably a really welcome expansion there. So then I go here, and we actually be very careful not to poke yourself and not to bend the needle as you go in there. You have to come at it at a straight angle and just go slow, go right in the middle somewhere. And then we hold the bottle upside down so that all the liquid is at the bottom of the vial. If I try to draw it up like this, I'm gonna get air. So we flip that over, and it doesn't matter if there's air or not in the syringe. A lot of times if there's not enough pressure in the vial, it won't come out. So you can backfill with air. You can backfill with air before you insert the needle. Very carefully in there so it doesn't bend. And then give it a little whoosh. You saw those bubbles. Give it a little whoosh of air to have enough pressure in the vial to then you can see the liquid filling there. So I'm like watching my screen and watching what I'm doing. And then you fill it up to your respective amount of units, depending on what your provider has prescribed. Yours might not be clear like this, even though we all know this is not tirzepatide or a GLP-1. This is bacteriostatic water, but sometimes when they're, depending on if they're compounded with glycine or if they're compounded with B12 or B12 with glycine, yours could be pink, and that's okay. If yours is pink, that is just fine, as long as that is what your provider has ordered for you. So say I ordered as the provider my patient to inject 10 units. So I would draw this up, and I go a little bit beyond the 10 to be able to squunch some of that out so that I don't have a bubble sitting here. Now, regardless of what you've seen on a medical drama on Netflix or any series, a bubble like that is not actually problematic in a subcutaneous injection for any physiologic reason, unless you are a very unhealthy, unwell individual, in which case you probably are not doing these injections on yourself at home. A bubble like that is just fine if you get a little bubble. It's not going to hurt you in any way, but it does decrease the amount of medication that you're getting because of the space that it's taking up, some of which is air instead of medication. So I backfill more and then squunch out any excess to get it right to the units where I want it without significant air bubbles in there, so that I'm getting the right amount of medication. And then you are good to inject this. So go ahead and very, very, very carefully. Now these needles are known, if you don't do this slowly, carefully, to just gently rest it on the cap, don't shove it hard, because that increases the chance that that needle will actually poke out. It will bend and poke out sideways. So you're barely resting the cap there to make sure it's sterile. Then I have my second alcohol gauze or alcohol wipe, and you're gonna go ahead and clean off the area. Now I am not going to inject this into my arm. Pretend this is my abdomen or the back of my arm or my thigh that I'm gonna go ahead and clean off, give it a nice good rub, and without do not blow on it, you guys. Never blow where you're about to poke a needle, okay? Let it dry, let it air dry. That's part of the sanitization process. And then you would mark that as this spot. You would know that that's the spot that you're going to inject, or that a loved one or helper is going to help you inject. I'm not going to inject bacteriostatic water into my arm because that would sting really bad. So pretend, boom, transplant. This is my injection site now, not the vial. And I'm going to, at a 90-degree angle, put my needle right down into it. And it can help to pinch there, not too tight, but help to pinch the skin, and then put in the needle and then just inject. Now, what you didn't see me do is when I went to inject, I didn't already have my finger on the end. Why? Because when you go to pinch up that skin, and then push the needle in, a lot of people, especially newbies, will squirt out the medication prematurely as they're injecting, rather than keep your finger off of it, pinch up the skin, inject the needle down in. See, it can bend. Do you see that? As a perfect example. I love that this showed that to you, because it shows, especially with, that's a tiny little needle, repeated uses, which you never use a needle more than once, but for demonstration purposes, hopefully you get that. You put the needle down in, and then you inject it so that you're not squirting out your very precious medication, peptide, longevity med as you're injecting. And then you just pull this out and dispose of it in a appropriate sharps container, whatever you have arranged with your provider, to make sure that is disposed of safely. And be, again, very, very, very careful. See where my fingers are capping this at the end. I was very careful. My fingers are nowhere up in this area, because truly that needle, it happens all the time. That needle will poke out sideways through the cap, and then that is safe for disposal. And then your medication, if it's a GLP-1, goes back in the fridge.